You're listening to Clinicians Roundtable on ReachMD. On this episode, we'll hear from Dr. Harish K. Gagneja, who's a board-certified gastroenterologist in Austin, Texas. He'll be exploring the factors that guide colorectal cancer screening decisions. Here's Dr. Gagneja now.
When I talk about colorectal cancer screening, I talk about colorectal cancer prevention. I really want to prevent colon cancer rather than screen for colon cancer. Having said that, there are multiple strategies which we use for colorectal cancer prevention. So we have to tailor that based on patient's age, patient's family history. What are the other comorbidities, other conditions patients have? Do they have any risk factors, whether they're high risk or average risk? Average risk is when they have no family history of colon cancer or colon polyps. High risk is when they have a family history of colon cancer or colon polyps. Some kind of genetic mutations which requires colon cancer prevention / screening more frequently, and also if they have any history of something like inflammatory bowel disease. Whenever I talk about screening for colon cancer, I talk about really all the tests which are available to the patient, but the best screening modality really is the one which gets done, right? So that's very, very important part. So now we have stool-based testing available. We have a gold standard, which is colonoscopy. And then we also have some newcomer blood test. So based on patient's age, preference, what they have access to, whether this is a colonoscopy or blood test or stool test, so we prescribe that. But one big caveat is that stool test and the blood test, they do not pick up precancerous polyps as frequently. Stool test pick up only 40% of the times, and blood test only 13% of the times. So second other issue is by using the stool test and blood test is that if it is positive, patient who's getting a test done, they should be willing to undergo colonoscopy as a follow-up. Otherwise, there's no use of doing any test if you're not willing to undergo colonoscopy after a positive test. Good news for colon cancer is that colon cancer starts as a little bump in the colon, which is called polyp, and those polyps become colon cancer. So if we take the colon polyp out with the colonoscopy, we really prevented a colon cancer. Patient will come and tell me, I feel fine, I don't need it. Yes, true, but that's the reason we're doing screening, because colon cancer will not cause any symptoms unless it's too late. That's why you want to catch it early on. I really talk about, as a patient jargon, I say, you know what? Skipping screening is like ignoring warning lights in your car dashboard. Car still runs, but you're ignoring the warning lights. Same thing is skipping the screening for colon cancer. Explain in a concise and clear language to your patient so that they understand that colon cancer screening is very, very important, because you can prevent almost all the colon cancers by doing screening. That is the very, very important part.
That was Dr. Harish K. Gagneja discussing how to approach colorectal cancer screening with patients. To access this and other episodes in our series, visit Clinicians Roundtable on ReachMD.com, where you can be part of the knowledge. Thanks for listening.